Assalamu alaikum everyone. So Dr. Hassan, I think you are the participant today.
Yes, Doctor.
Okay, can you see my screen?
Yes, I can see your screen. And should I start?
Yes, doctor, just read the scenario and then I will start the timer and I will start it for you. Please read the scenario aloud so that everybody can hear.
Okay, okay, okay. Mr. David, 79 years old male, came with lobar pneumonia. He was allergic to penicillin. The daughter of Mr. David informed the nursing staff about penicillin allergy, but somehow the message wasn't conveyed to the treating team, and the patient was started on IV ampicillin. Mr. David developed fever, rash, itching, and restlessness. Immediately, the treating team managed the allergic reaction and penicillin was stopped. The daughter is unaware of the allergic reaction. Your role, doctor in medical ward, your task, speak to the daughter of Mr. David and answer her concerns.
Okay, doctor, your time starts now.
Hello there, I'm Dr. Tasmeem, one of the doctor of medical ward today. Can I confirm the name and age, please?
Yes, doctor, I am the daughter of Mr. David, 79 years old.
And how should I address you?
You can call me Miss Iqbal.
Um, Miss
Miss Iqbal.
Miss Iqbal. All right, all right. Okay, Miss Iqbal. Before moving to our conversation, um, actually, today we are here together to discuss some health related issues of your father and address your concern and further management plan. Will that be all right?
Yes, doctor.
And before proceeding to our conversation, may I know that how much do you know about your father's health condition?
Yes, doctor. Actually, what happened is that my father has been suffering from some infection, some fever, and the doctors said that he has been suffering from pneumonia. So that's why we came here.
Okay, and do you have any specific expectation from our meeting today?
Yes, doctor. I assessed my father and I acknowledge that your treating team has worked quite well, and my father is in quite a good condition now. So, no specific concern as such.
All right, Ms. Iqbal. Um, I'd like to uh, inform you that you are quite aware that your father has come to us with chest infection, and later it was diagnosed as pneumonia, and he was given a medication called ampicillin, and that was given by the needle through her blood channels.
What,
Are you
doctor?
following me?
Is it some kind of penicillin?
Miss Iqbal, I'm so sorry to tell you, and yes, actually, it is some sorts of penicillin.
But, doctor, I actually told your nursing staff that my father has been allergic to penicillin. So I don't know how it happened.
Uh, Again, I'm so sorry to tell you that it was a mistake from our side, and I sincerely do apologize on behalf of my team that it was given in the best interest of your father's health condition, but unfortunately, we are unaware of that your father is allergic to penicillin, and that
But
is
doctor,
why
how it could be possible? I mean, how it could be possible that you people have injected such a bad injection to my father, despite that I told the medical staff over there.
I'm so sorry to tell you that yes, it was a mistake, and uh, I do apologize again, Mr. Iqbal. Definitely, there is some breaching in communication, and we will make an incident report, and we will inform our nursing in charge and ward manager, so that this kind of error will not happen in future, and will not compromise to healthcare of any of our admitted patients. Are you getting me, Miss Iqbal?
Yes, doctor, but can you please tell me the name of that doctor or the nursing staff who has injected such a bad injection to my father?
Actually, I do appreciate your concern, Mr. Iqbal, and no one is individually responsible what happened to your father. I mean, as giving this penicillin suddenly, your father developed fever, rash, itching, and he became restlessness. But the treating team the managed the situation, and immediately the penicillin, that ampicillin injection was stopped, and right now his condition was stable. And I'd like to say that we all are equally responsible for what happened to your father, Miss Iqbal.
Okay, doctor, can how can you make sure that this will not happen in the future?
Ma'am, some noises are here.
Yes. How can you make sure that this thing will not happen to my father or any other patient?
I appreciate your concern, Ms. Iqbal, and actually, in your father case or in other patients' case, we will write in block letter that your father is allergic to this medicine, and we also notify the risk management team who will follow up the case, and who will take necessary steps to prevent such kind of occurrence in future. Are you following me?
Actually, doctor, I want to talk to your consultant because I want to launch a complaint against your staff.
Actually, Miss Iqbal, it is right, and we can help you by referring um, the patient advice and liaison service, in short, PALS, who will take your complaint and will do the needful. Will that be okay with you?
Can you please tell me a bit more about this?
Actually, if any unwanted mistakes or any unwanted event happened in any patients, in that case, we'll make the incident reports, and if the um, patient or patient's relative wants to make a complaint, we guide them to patient advice and liaison service. They are individual body, and they will take your complaint and follow up your case, so that this kind of occurrence will not happen and doesn't compromise the healthcare of our patients.
Okay, doctor, 2 minutes are
Are
left.
you are you on the same page, Miss Iqbal?
Yes, doctor.
Uh, Miss Iqbal, may I know what is your concern?
Actually, doctor, just I want to launch a complaint and I just want to make sure that such thing does not happen again to my father or any other patient.
Uh, I feel so sorry what happened to your father, and again, Miss Iqbal, I do apologize on behalf of my team what happened to your father. But I can reassure you that your um, father's condition is quite okay, and we will give him the maximum treatment, and we will give you the proper information from time to time. And regarding similar mistakes cannot happen, we'll take our necessary steps. Do you have any other concern, Miss Iqbal?
No, doctor.
Miss Iqbal, again, I'm so sorry, and I can understand that how much you are going through. And
Mhm.
again, I do apologize on behalf of my team. If you have any other concern, I will try to meet it, Miss Iqbal.
No, doctor. Thank you. Still, you have 30 seconds.
Thank you.
Okay, doctor. Time is over almost. So overall, Dr. Hassan, it is a good attempt, I would say, because this is the tone of voice whenever you encounter a medical error case in your communications case. Okay, so always you will encounter such a patient who will be a bit angry or who has a loud tone, loud voice. So it is your task that you have a low tone and a bit more empathetic. All right, so overall it was a good attempt, a very good attempt. I just want to add a few points, and I would suggest that yes, it is good thing that you keep on apologizing, or at least say sorry 2 to 3 times, but try to add a few more points in this regard. All right. So let's start this scenario again. For example, yes, you enter the room, you will greet your examiner, you will greet to the surrogate, and then after that you will introduce yourself, and then you will check the identity of the surrogate, and you will confirm the relation of the surrogate with the patient. All right, then you will build some rapport. You will just say nice to meet you, or I hope you are comfortable in this room, just to start your conversation. All right, so after that I would suggest you in this case that before starting your scenario, you should say that I have already taken permission of your father to speak to you in this regards. So, is that okay with you? Because it will leave a good impression on the examiner that the patient is competent and you are talking to his daughter. So, you have to at least assess that you have taken the permission. Okay, Dr. Hassan.
Yes, ma'am.
Okay, and then after that, you will. It's very good that you take the insight of the surrogate and you ask for the any specific concern. After that, whenever you are starting your explanation, whenever you are outside in the hall and you get the scenario, this is what happened, which I also felt in my preparation, that to start the scenario we should have some good line now, because at that time we all know the steps what is going on, but for that specific scenario, for example in this case you can say that yes doctor, for example sorry, yes Miss Iqbal, I appreciate your knowledge regarding your father's health condition, and your father, yes, you are right that he has been suffering from chest infection and he came to our hospital, but actually I came here to share a little bit bad news to you, and meanwhile I will also offer some apology. And then you will say that I am really sorry to inform you that by mistake your father has been given the injection of ampicillin. After that, you will give a bit pause of 1 to 2 seconds, because the surrogate will himself say that what ampicillin is, it penicillin, or why you have given, and it will generate concerns. All right, and at the same time you will manage those concerns, you manage quite well, and after that you will tell her immediately that uh, your father developed some reaction, but luckily we were able to manage it immediately and we stopped the penicillin, and then again you will apologize, and you will say that I'm very sorry this incident has happened in your father's case, and I can acknowledge your feelings, and I can see that it is a very distressful condition for you, and I apologize for you as a as my whole team. No? You said this sentence quite well. Okay, one thing I want to mention here is that whenever there is medical error, it is good that you will just inform what medical error has occurred, and after that you will apologize, and then you will follow a few steps. For example, yes, immediately you will say that we will write an incident report, or we will fill the standard critical incident form. Okay, and for this incident report our root cause evaluating team works, and we will make sure that such thing will not happen in the future. You will also say that I will involve my consultant and I will let him know about the occurrence or incident which has happened uh, in case of your father. And you will also see that apart from incident reporting team, I just want to add one point over here, that you can say, just to ease the surrogate, that we will have our mortality and morbidity meeting, and you are allowed to attend that meeting, and at the end of the meeting you can express your thoughts. Okay, so this is just an additional point to a medical error case. Okay, and then you can also instead of jumping right towards the polls, you can say that every hospital has hospital complaint department, and then you will say that it consists of the consultant, the senior staff, and the medical staff, and the nursing staff, and they work on the medical error or mistake, and they evaluate it and come up with the report in a couple of days or weeks. But for example, in that case, the surrogate may say that no, doctor, I don't have confidence on your hospital. I want some other way of launching the complaint. Then you will tell about the POL system. And for example, if you tell about the POL system, you should also tell its abbreviation now, that Patient Advisory Licensing Services. And yes, you told very well that it is a third party system, and it has no concern with our hospital, and it is a service for formal complaint. Okay, and rest you performed quite well, and it is good that you keep on checking the understanding, and it was a two-way communication basically. All right, so any questions from anyone?
Ma'am, if you do marking, what will be the marking?
Okay, doctor, I can give you almost 14 to 16 marks in this scenario. I mean, just in case if there is some lenient examiner or a good examiner, you can say he can give you 16 out of 16 uh, in this performance. Okay, but if it is a strict examiner, he can say that there was some repetition, or for example, if he is thinking about patient, for example, he is thinking about some other system of launching the complaint, for example, mortality morbidity meeting, or information to the consultant, or hospital complaint department, he can give you 15, but still it is a very good performance. Okay,
Okay, ma'am. Thank you.
all right. So if there is no other question, then